Hi everyone, so in this video we're going to show you, give you a little orientation to our simulation center. So hopefully on the day of your simulation you're a little bit more familiar of the equipment that we have here in the Sim Center and where to find supplies and things like that. So first I will begin with our simulator. We actually have two in our sim space and they function very similarly. As you can see, our patient is blinking, so he blinks, he does talk, so you'll hear speech coming from him. He has chest rise, he has heart, lung, and bowel sounds. He has pulses, carotid pulses, brachial, radial, femoral, popliteal, and pedal pulses, and they're all bilateral, so you guys can assess those during your sim. I want to show you one thing on his chest when you go to auscultate. It looks like there's some stickers on his chest, and sometimes students are a little inclined to think that they need to put their stethoscope there for auscultation, and these are actually for if you were going to do like an EKG on your patient, and helps to know where to put the stickers. So for auscultation purposes, it's just like a real patient. You can listen anywhere on the chest to auscultate however you would a real patient in the hospital. So don't be confused by what's on his chest with those sticker looking things. Another little tip would be when you go to listen posteriorly, they both have posterior breath sounds. They're very heavy and they obviously can't help you to sit up, so make sure that at least two students help lift the student so that you don't hurt your back or anything like that. And then just support their neck, because their neck can sometimes tend to fall backwards. So when you sit them up, just make sure that you have their neck under control. Moving on to some of their other functions, they have actually real IVs, and so it'll be hooked up to an IV pump in most of our simulations. And so that functions very much like it does in real life. There's a separate video that we go over how to use the pump and all of the pump's functions, so look for a separate video for that. But looking at his arm, it should look pretty much exactly how you would see in real life, and it's actually infusing fluids into the patient. So the only thing that's different is that the tubing that's coming from his arm here, obviously you wouldn't see in a real patient, but we have to have somewhere for the fluid that flows in to come out. So as you can see, it's kind of draining into a garbage can here. So just make sure during your simulation that you don't move the garbage can, or it'll start pooling on the floor, and we don't want anyone to slip. Let's see, moving on to some of their other functions that you guys might be a little familiar with from downstairs in the VLC. The patient or the simulator has two deltoid, and they have two vastus lateralis injection pads, so you can actually give a real injection with fluid in it. So you would draw that up just like you would in real life and inject that into them. The only thing that we do ask that you simulate and not actually do is if you have to give your patient a pill, we don't want it to go into their mouth because we don't have a way to get it out if it goes back into their throat. So please just make sure you're simulating that and not actually putting a pill in their mouth. Some controls for the bed. They're very simple on this bed. On the outside, on both sides of the side rails, the buttons push the bed up and down. And then on the inside of the side rail, you might have to move the covers out of the way. It has the head and the feet. There's a button on both sides that you can push in, and then push the side rail up towards the head of the bed, and that pushes the side rail up if you were to need that at any point during the sim. And then now I'm going to move over to the whiteboard. There's one of these in each of the rooms. They're on opposite walls, and we strongly encourage and expect you guys to have these filled out during the simulation. It's a safety concern if it weren't to be filled out. Hopefully you're seeing them in the hospitals. There's plenty of you guys in the simulation, so hopefully at least one person can get that filled out at the beginning of the simulation. And then anytime anything were to be updated, if you receive new orders from the physician, or something changes in their care, then you would be updating that as you go. Each room has a computer on wheels that we have a laptop on so that you can do your electronic charting. And that will be a separate video as well, how to navigate through the charting system that we use. So look for that video as well. There's a Sharps container here with gloves underneath. We don't recap, just like in real life. We don't want you guys to be recapping. We don't want anyone to get stuck. So if you give an injection and the simulator, then the needle goes straight to the Sharps container. We don't recap anything. Usually we keep size medium gloves in these glove containers, but I'll show you where other size gloves are if you need something. The pump I said was another video. Next I'll talk about the oxygen. It's not actually hooked up to an oxygen or an air source, so if you turn the knob here, you're not going to see the ball moving up and down because it's not connected, like I said. So we have a rubber band, and we just ask our students to move the rubber band if you want to increase the oxygen. Then we'll be able to see you kind of move to whichever liter flow you want based on wherever your rubber band is set. Now I'll come over to this side. These are suction canisters that actually do work, so if you turn them on, you'll hear them turn on. It's kind of loud, so you have access to the suction if you need that during the simulation. Next is our patient's monitor. So here you can see we have heart rate on the top, respirations, the SpO2 or the pulse ox is in the blue, the temperature is down here, and then the blood pressure is in the red in the bottom left corner. Just a couple things about this if you're new to this. The heart rate, the respirations, the SpO2, and the temperature, you kind of see the numbers fluctuating. They update on their own, so you don't have to push any buttons for that. It'll just update automatically based on whatever your patient's heart rate or respirations are. The only thing is that we ask that you don't use this just solely as a tool to take your patient's vital signs. Remember, we want you to take your vital signs off of your patient. So you should always be auscultating heart and lung sounds and then using the monitor just as a verification tool. But then, of course, your blood pressure and your temperature, you'll be relying solely on the monitor for those. And to take a blood pressure, there's the cuff over here. One other thing I want to point out is a temperature conversion chart. So if you look, the temperature is in Celsius. So we have a chart here. You just can kind of go down, see what the patient's temperature is in Celsius, and then you can look to see what it is in Fahrenheit on there. It's a quick little way. So this part is also kind of simulated since we don't have Dynamaps, but it works pretty much the same way. You'll get your cuff out. You'll actually put it on your patient. The two don't link in any way, but like I said, we just want you going through the motions and kind of getting that hand-eye coordination of how you would actually be doing it in the hospital. So once you put the cuff on the patient, then you'll come over here to the monitor and you'll see NIBP, which stands for non-invasive blood pressure, which is just like what we're doing on the arm. And it's set in manual mode. So you need to click on this bar here. And then it brings up this box, and the first one says STAT, and you click on that. And then you can notice that it kind of zeroed out, and then you're going to see the numbers counting up, and then they'll kind of start to count back down, just like you would see in real life. So that takes a few minutes to do. And then I'll show you a cool feature that it has if you push this little like timer looking thing right here. So there's your blood pressure reading. If you ever push this button here, it shows your latest blood pressures. So if you ever want to see a trend, or if you're ever calling the physician or need to be giving a report about your patient's blood pressure, you can always click on that and see what your previous blood pressures have been. And then you just click outside of it. Sometimes, because this is a touchscreen monitor, if you're not touching in the right place, it might not work. So just click on it a couple times just to make sure that you're getting your blood pressure, that it goes to that hash mark to make sure that it's zeroed out. All right, so I think that's pretty much everything. Oh, one other thing I do want to tell you. All of our patients have an armband, and we'll talk about that a little bit more when we go over the charting system and scanning medications and things like that. But remember that any time that you're going into your patient's room for the first time, you want to be checking their armband and doing your two patient identifiers to make sure that you have the right patient. And we have hand sanitizer here. We don't have a sink station, but you can use your hand sanitizer to wash your hands as well. And then lastly, we have AIDIT cards in each of the rooms. We expect that you guys will be doing AIDIT when you first enter your patient's room. And you'll be given a name tag when you come into SIM, and on the back of that name tag it'll have AIDIT as well. So if you need to refer to that during the SIM, we try and give you those resources so that you can use them and practice those during the simulation. So next, I'll just briefly show you a couple things in here. Like I said, this simulator has the exact same functions as the one in the other room. They're made by the exact same company, just one's male and one is female. She does have one difference though, and that is her left foot. And I just want to show this to you guys because when you do your assessment, I would hate for you to be surprised if you see her foot has a wound on it. It's not a part of our simulation, it's just the foot that came with the simulator when we purchased them. And so it's not a part of any of our sims, so just pretend that you don't see it because we don't want that to be confusing for you guys. One other thing that you might, excuse me, that you might notice when you're doing your assessment on your patient is if you ever see a yellow tag that might be placed somewhere, like a sticker on their body, it might say something like 2+ edema or less than 3-second capillary refill. Those are things that we can't simulate on the simulator, and so we have to put those tags on to let you guys know what we want those findings to be. So if you ever were to find those during your simulation, you can go ahead and chart that as a finding. We just don't have any other way to simulate that except for through that tag. Her bed is a little bit different, still very easy to use. On the outside it has the bed height as well as the head and the feet. On the inside it has the head and the feet as well. And then everything else in her room should be very similar to the room that I just showed you. And then I'll move over this way to our supply cabinet and our medication cart. You guys will be using those a lot during the sims. You can access any equipment that you find in there. You guys are welcome to use. We do have separate videos for the medication cart and the supply cabinet, so I'm not going to go over those right now, but look for those separate videos. And then lastly, I just want to point out our crash cart. And so if you guys ever were to need that during a simulation, you can find those located there. I hope this was helpful. You can feel free to watch this several times. The more familiar you are with the layout of the sim center and where the equipment is and the functions and everything like that, it really will help make your simulation experience when you come the day of a lot smoother. And so we hope that this was helpful for you guys to kind of navigate through where all of the equipment is and how everything works.